This is Dr. Maha from Adela's Medical Videos and Podcast, and today I'll be discussing depression with Dr. Aisha Jamil, who is a classified psychiatrist. Hello, Dr. Aisha.
Hello.
Okay, let's start. Can you tell us what is depression?
Okay, depression is a mental health condition which is like sadness, but it is much more than that. It is not just sadness, it has many more other symptoms. Like, for example, being sad because of no reason, because of no obvious reason, number one. Number two, having a lack of energy, so much so that you are not able to do your daily activities like you used to. Then not having any interest in the activities that you used to enjoy previously. Also, things like having disturbed sleep, disturbed appetite, changes in weight, and changes in your libido. Then also, general pessimistic mindset, developing a pessimistic mindset such as hopelessness, helplessness, excessive feelings of guilt, thinking about death or suicide, and also things like having poor self-esteem, thinking like you have no value, anything that you do has no value. So such symptom complex is called depression.
Okay, can you tell us about the early signs of depression?
Depression may start in multiple different ways. Sometimes it starts in the background of some obvious life stresses. For example, somebody is going through a grief process, somebody's close has died, and they are going through a difficult time, or they're going through a divorce, or they're going through a major life change, and sometimes depression may start in those circumstances. Sometimes it starts with no such background. Normal life is passing by, and all of a sudden you start feeling, out of the blue, you start feeling these symptoms of sadness, low energy, loss of interest in pleasurable activities. So early on it may start with these kind of symptoms, or sometimes patients also, many a times they many a times the patients express that they have a difficulty in going to sleep, in they're waking up in the middle of the night multiple times, having difficulty going back to sleep. They're waking up much earlier than they used to, and when they wake up they feel tired. So when they wake up, they're feeling tired, they're not feeling refreshed. So these are some of the early signs of depression.
Okay, can depression be treated without medication?
The answer to this question is not a simple one. Yes, depression can be treated, but under certain circumstances. If I were to simplify this, I would say that there are two sorts of treatment for depression. One is medication and one is psychotherapy. For most of the times, for most of the patients, both should be undertaken, medicines and psychotherapy. The only times that I would say that medicines are not required are when the depression is very mild. So much so that it's not affecting your ability to function in your daily life.
Yeah.
You're able to take care of all your responsibilities. It's not that much. Then psychotherapy may help you. Psychotherapy alone may help you. But if your functioning is getting disturbed to the extent that you are finding it difficult to perform your daily activities, you have a severe lack of energy, you have no motivation to get up and perform your activities, then definitely medicines will help you to get to the point where therapy will be effective.
Yeah. Can you tell us more about the misuse and malpractice of the antidepressants seen nowadays, the overprescription of these medications?
Yes, this is a very, very good question. Number one, I would say that um, the knowledge of these antidepressant medication is with the psychiatrists who are trained in this, not other specialty people, you know, and not the other psychologists. Why I'm saying this? I'm saying this because these people do not have, people other than psychiatrists do not have full knowledge of when to start an antidepressant and when to stop it.
Yeah, that's true.
So the important thing is that we start these medication, you know, we continue them for a specific amount of time, you know, generally speaking, you know, for a few months we give depression. After that, the depression, when it settles and the patient is stable for some time, we stop these medication,
Yeah.
you know, and we stop this medication and then we monitor the patient's symptoms, you know. So
Okay.
a psychiatrist does it properly because he or she is trained to do so. But people from other specialties and people who are, you know, not doctors, they are not able to do it. So yes, having said that, there are certain patients whose depression is a bit chronic, you know. It's a very chronic relapsing remitting illness in which the depression goes on maybe for a lifetime. So there are
Yeah.
15 to 20% of patients who may need antidepressants for a lifelong, but not all
Oh.
patients require it. You know, again, this kind of, you know, information, this kind of advice is only to be taken from a trained psychiatrist.
Yeah. Thank you so much. It was lovely talking to you, Dr. Aisha. I hope to see you in more videos discussing more mental issues.
Thank you.
Thank you.